Welcome to the MedCoShare podcast, the podcast where we learn everything about what it's like to be a private practice healthcare practitioner in today's world. We dig deep into the challenges of being a healthcare practitioner, but also the rewarding aspects that the work entails. My name is Ronak Vyas, and I'm the CEO and co-founder of MedCoShare. On today's episode, we have Dr. Michaela Mocanu. Dr. Mocanu attended Davila University of Medicine and Pharmacy in Romania, where she received her medical degree. She completed her internal medicine residency at Georgetown University Hospital and her nephrology fellowship at the University of Pennsylvania. Dr. Mocanu, welcome to the show.
Thank you so much for having me here. I'm super excited to be here and talk to you.
Awesome. Yeah, so just jumping right in, explain what nephrology is and what you do, and what inspired you to choose this specialty.
So, nephrology is the branch of medicine that focuses on taking care of the kidneys. And the kidneys are vital organs, as you know. They help us control our bodily fluids. They help us control our blood pressure, detoxify our bodies, control our electrolytes. And we really could not live without them. So, as a nephrologist, what I do is I help people live longer, healthier lives by improving their kidney function or slowing down the progression of their kidney disease or controlling their blood pressure, which lowers their risk of stroke or heart disease in itself, let alone the risk of progression of kidney disease. Mm-hmm. And also something that people don't know is I can also help prevent kidney stones. Mm. So as a nephrologist, and I am surprised that most of my patients don't know, as nephrologists, we can help prevent kidney stones, as well as the urologists who help manage the complications of kidney stones. They take out the kidney stone. And as a nephrologist, I carefully look at the urine and the risk factor somebody has for forming kidney stones, and I can help with lifestyle interventions and new medications for that.
Sure. So, what are some common, ways people get kidney stones, and do they come to you when they're in pain, or just tell us a little bit more about that?
Thank you for asking that. Most patients who come to me for kidney stones have passed several kidney stones throughout their lifetime, or they have been referred by the urologist or by a friend. So what we do in situations like that, we take a very thorough medical history to kind of get a sense of what their risk factors for forming kidney stones might be. And then we look at objective data, such as we collect 24 hours to 48 hours. The first set of urine that we collect, the best is to collect 48-hour urine. So it improves with accuracy. And we look at various substances in their urine that puts them at higher risk for forming kidney stones. And that's how we can tailor treatment individually to every patient, because every patient is different, right, based on their risk factors, or their family history, their lifestyle habits in themselves.
Yeah. So Dr. Mocanu, tell us a few ways that people can prevent kidney stones.
Yeah, so I think that general principles that would apply to everyone would be, one is to stay very well hydrated when we have history of kidney stones and when someone has passed several kidney stones several times in their lives. Number two, limit salt intake is very important. And surprisingly, don't avoid calcium in your diet. Unlike the general thought that calcium leads to kidney stones when taken in the diet, it actually is quite the opposite. We do normal intake of calcium is advised for patients with kidney stones. Okay. And just eat your fruits and veggies to keep a healthy microbiome in general. This would be the minimum things that anyone can do, even without having tailored lifestyle interventions or tailored treatment for kidney stones. Okay. And by just doing that, one can prevent kidney stones in general.
Does exercise have any role in this, or is it 100% diet?
Well, exercise may have a role in this if we get very dehydrated and don't drink enough.
Okay. Got it. And how does diabetes and high blood pressure impact kidney function?
Diabetes, and thanks for that question, because majority of my patients suffer from both diabetes and high blood pressure. Both are big offenders of the blood vessels. So diabetes affects primarily the small vessels in the kidney. You may recall from school that the kidney has these tiny filters called glomeruli, and they're formed by very, very tiny blood vessels. So diabetes affects those tiny filters that help us reabsorb protein back in our body. So first it filters the protein out, and then it reabsorbs it in our body. And with time, people with diabetes tend to lose protein in their urine, and this protein that is lost in the urine can be very toxic to the kidney. It leads to inflammation and scarring, and that's how over time it leads to kidney disease. Now, high blood pressure, as opposed to diabetes, tends to affect larger vessels. We don't typically see so much protein in patients affected by high blood pressure alone, but both of them are lead causes of chronic kidney disease in this country.
Got it. So you started with us, your private practice in our King of Prussia location just a few months ago. What's your experience been like so far?
So far, I love it. So let me tell you a little bit more about my practice first and foremost, so you understand, because I have a different setting of practice than most nephrologists in this area and in the country altogether. I run a direct care hybrid model of practice. What that means is that I accept patients that are covered by Medicare Part B, and all the rest of the patients in the practice follow the direct care concept, which is nothing but concierge without paying that membership monthly fee.
Right.
So what that means is that I have the advantage of having more time to dedicate to my patients. I spend more time with my patients. My patients have direct access to me via a HIPAA-compliant line. So if they have burning questions, let's say, they can just reach out to me directly without any intermediary to answer their question. And it does give me, the biggest advantage to me as a physician of running this practice is that it makes me feel like I'm really practicing medicine the way I imagine that medicine should be practiced. I dedicate enough time to every one of my patients. I get to learn more about my patients. I have a fewer patient population, so I get to learn all about them, and I get to know them very well. And the biggest advantage to the patient is that their physician actually dedicates them more time. I can get to learn about all their conditions, and I feel that we have a better patient to physician relationship, and we can establish that trust relationship. That sometimes is impossible to achieve when you're in the traditional setting where you have to see, let's say, 4 to 5 patients an hour. So overall, I'm very happy with how this new model, I wouldn't say new, it's not a new model, but how this model works for me and my patients right now. It's very rewarding as a physician.
Right. So you said you don't do a monthly model, so are you just charging hourly?
For patients that, yes. So to answer that question, yes. I'm charging, like I have a special fee for the initial visit and a special fee for a follow-up visit. But for patients with Medicare, I don't charge anything extra. I just go by the Medicare fee.
Okay. Makes sense. Yeah, I know this is a novel thing where just concierge care in different specialties is popping up more and more. But I can't imagine it being like easy to educate and to get new patients. So how do you market your practice? What are you doing to get your name out there?
First and foremost, I have a website, and I have a blog on my website. I would recommend that people check out my blog. It is focused on kidney disease, hypertension, and weight loss.
And what's the website?
www.weightkidneycare.com.
Okay.
Yeah. And on my website, I also have a special page dedicated to helpful education materials that are free for patients to use. And I gather those from different conferences at which I participated. Mm-hmm. And I use them frequently to educate my patients. For instance, I had a patient just the other day, their question was, okay, so how much protein is good for me?
Right.
And to give them a very adequate answer, of course, this is a special situation with chronic kidney disease. We follow the KDIGO 2024 guidelines for that, and then I gave them the answer for that. But then the patient had a visitor with him. So the daughter had a question, how much protein should I have? And, it's rude not to answer. So I actually had to look up information for that. I found it on the Harvard Nutrition website, and it is one of the listed education material on my website, My Healthy Plate and the Harvard Nutrition source.
Yeah. So that must take up a lot of time too, right? To research, to write, and then to post everything.
But I enjoy it. I feel like it gives me the opportunity to learn more, and it also gives me the opportunity to kind of prepare for my patients, to kind of find a way of better explaining to them what their condition is and how I can help them best. Mm-hmm. So it has it's a win-win for everybody.
Yeah. All right. And I know you're a physician affiliated with Mainline Health. How does that help with your marketing?
It helps a lot because I am I'm easily to be found on the Mainline Health website as one of the nephrology and obesity medicine providers there, as well as it allows me to connect with primary care physicians within Mainline Health.
Very nice. And, going back and talking about the conferences, I know you're always on the top of, new research. Are there any advancements in nephrology that you're most excited about?
Oh, yes. So thank you for asking that question, because I couldn't be more excited as probably every single nephrologist in this country. Literally, the past 5 years in nephrology have meant so much. There are so many advances. Nephrology has changed altogether. It's only like about 2 weeks and a half ago, a new study was published in one of the most prominent medical journals in the world, the New England Journal of Medicine. Mm-hmm. And it was about how the newer weight loss medications, such as Ozempic, though people know it as Ozempic, it's semaglutide, but how it can actually help with improvement in kidney diabetic disease.
Okay.
It can prevent further decline of kidney function and progression to dialysis, and it can help patients live longer altogether. They can have fewer cardiovascular risk when on Ozempic. One of the biggest care for nephrologists is having protein in the urine. As I was mentioning previously, it can be toxic. It's like Drano on the renal tubules. It can be corrosive and toxic and causes a lot of inflammation to the kidney. So by just a lower dose of semaglutide, which people commonly know as Ozempic, according to this new research study, which was extremely well done, it can lower protein in urine by as much as 40%.
Wow.
So it was amazing information. Now, there are other medications also that came up within the past 5 years. And there are medications that we found out that not only do they help with diabetes, but they also improve cardiovascular risk in patients with chronic kidney disease or in patients with heart failure. People may know them as flozins, dapagliflozin, empagliflozin. And I don't want to get too technical here, but overall, in nephrology, the past 5 years meant a lot. Not only do we have newer medications for using chronic kidney disease, but we have newer medications for using glomerular diseases. One of the most common of which is IgA nephropathy. There are 2 new medications that we can employ there, and the guidelines there have changed altogether too. So the future looks bright in nephrology, and I hope that more people want to go into nephrology field because there is hope that we can do more for our patients than what we could do 10 years ago when I graduated.
Yeah.
Pretty much.
So, drugs like Ozempic and Mounjaro are, taking up a lot of headlines, I would say. So now you in the mainstream knows about these drugs. What are some of the side effects? Because you also for your practice help with weight loss for your patients. Right. So what role do these drugs play in that?
So let me explain to you how I put it to my patients so they better understand. You see, we call them drugs, but in reality, they're nothing but analogs of hormones our body naturally produces. And it is possible that with changes in environment, exposure to fast food, with age, maybe there is our bodies is less able to produce as much as these hormones that have an essential role into maintaining a happy and healthy brain-gut axis and keeping our weight under control. So some people may need a little bit of these hormones to help them achieve weight loss, and they're very effective for achieving weight loss. But I don't really like to think of them in terms of drugs, simply because they are literally analogs of hormones our body make. It's like, yes, they are drugs, but so is synthroid or levothyroxine, which we use for hypothyroidism. So is insulin that we use for diabetes. So they're in the same class of in the same class in the sense that they work in a similar way of restoring hormonal balance in our bodies that help us achieve a healthier weight. Okay. So of course, as every medication that we use, they can have side effects, but I also believe that these side effects are coming from the fact that your body needs time to adjust to having that hormone back within the body, because what research shows is that the side effects are typically dose dependent, and it also happens that when we take, let's say, a certain dose of this medication and we maintain the patient at the same dose, with time the side effects go away. So their body gets used to the medication, and then is when they don't feel the side effects. Like the most common side effects of this class of medications are GI side effects, because that's where they work in the brain, but they control how fast our gut moves. What they do is they make you feel less hungry. They help you have fewer cravings, but they also slow down the motility of your gut so that you may feel fuller, may feel full after eating, let's say, half amount of your the plate in front of you instead of eating the whole plate. So you feel like, okay, I don't need to eat anymore. I'm already full. I don't need more. And they also work on the metabolism. They improve our insulin resistance in our body. So they really tackle they tackle different mechanisms to help people achieve weight loss. And as I was saying, the main side effects are GI-related side effects. Like you may feel a bit nausea if you eat too much, and it takes time for the brain to realize how much you ate. There is a lag of about 20 minutes. So we eat, and then we don't realize, 20 minutes later, it's like, I was full maybe a while ago, and I kept eating. You know? Yeah. So that's one of the main main side effects is nausea. Some people have surprisingly diarrhea. Other people may experience constipation. Some people may experience nausea. Some people may experience more reflux as the gut motility slows down. So the most dangerous side effects, the most dangerous, I shouldn't say side effect, but rather association with this medication would be pancreatitis. And in rodents, they found that very large doses of these medications have been linked with a higher number of a certain type of thyroid cancer. Mm-hmm. But the no of taking these medications would be acute pancreatitis, especially when we think it's related to the drug.
Okay.
A certain type of thyroid cancer, medullary thyroid carcinoma, not every type of thyroid cancer. And of course, we don't give it to pregnant women because we haven't studied pregnant women, so we don't want to risk complications, and it's hard to enroll pregnant women in the studies. Nobody would want to try, although they are doing studies where women, you may have heard of Ozempic babies, right? So women can get pregnant easier after being on this medication because when losing weight, the hormonal balance in the body reestablishes and then they get pregnant easier. So far we do not know of major side effects of these medications on children, on babies, but it is a subject I can't talk more about because we really don't have enough data. Yeah, we're waiting for data.
Yeah, no, but this was a good kind of like synopsis, and I know like a lot of people are interested in just like learning more about Ozempic, Mounjaro, and then as it relates to weight loss. So with your practice,
if I may add more,
sure.
So these medications are not just weight loss medications; they literally improve a lot of health problems. Medicare has recently approved semaglutide, also known as Ozempic, for cardiovascular risk protection.
Right. Because
people have fewer strokes or heart attacks. And, we've learned that chronic kidney disease protection, fatty liver disease protection.
Now, you mentioned diabetes as well, right?
Well, yes. Especially diabetes, they were actually designed for diabetes, and then we've seen that patients with diabetes who took these medications had so many benefits, such as that started with weight loss, but then we've learned they have fewer strokes, fewer heart attacks, improved sleep apnea, improved GERD, a lot of things.
Right.
So really, I'd like to think of them more than just medications. I'd like to think of them of like a replacing a missing link in your body, such as giving back your body a teeny bit of the hormone that your body is missing in order to reestablish that balance that was lost.
Yeah, makes
damaged.
sense.
Sorry I interrupted.
No, all good. Yeah, and really good like synopsis. And no, I apologize if my questions are a little basic. You're the expert here, so
they're not basic at all.
So where do you see the field of nephrology heading in the next decade?
Oh, as I said, I'm super excited because there are a lot of advances in nephrology. Nephrology is a very complex field, and there are many factors that can affect kidney function, all from diabetes, hypertension, but there are autoimmune diseases that affect kidney function, and there is polycystic kidney disease. There are kidney stones. There are lots of factors, and every single one of these fields, there's transplantation in nephrology. Every single one of these fields has seen significant advancements. You may have heard, just because I just mentioned transplantation, you may have heard of xenotransplantation being on the pages of the magazines recently, right? So there have been advances that they're working on, like an artificial kidney. They're working on optimizing these machines that provide dialysis at home, and of course, in terms of medication, our hope as nephrologists, I think, is to have sufficient medications to postpone progression of chronic kidney disease or to improve our patient chances of healing from a specific disease to keep the patient in remission. And here there have been tremendous advances, and there are new medications. I can think of at least 5 of them right this moment, and we hope that with more research and better research being conducted right now, we will learn more about how to best help our patients. And of course there is AI, and I have no idea how AI will change the nephrology world, but I'm pretty sure that it will be contributing to changing nephrology too, as well as entire medicine. We would be better at diagnosing diseases with AI, hopefully.
Right, AI is changing the world. Can you share like a memorable patient story that significantly impacted you?
Sure. I'll share a story of one of my first patients in this practice. I have many memorable patient stories, whether being here or at the hospital, but this was one of my first patients seen at this practice, a very, very young man in his 30s who came to me for uncontrolled elevated potassium levels. And as a nephrologist, one of the scariest electrolytes besides sodium is potassium, because potassium can kill somebody when it's very high. Literally, it causes this abnormal heart rhythms, and somebody can die from it. So there was a big concern. His primary care had a big concern because this man was young. He was on medication to lower his potassium level, and every single time he would check his labs, despite having a normal kidney function, his potassium was high. He had to go to the hospital, to the emergency department. He was sent a couple of times to the emergency department for high potassium. He had seen at least 2 nephrologists before coming to see me, and at least 2 endocrinologists.
Oh, wow.
Yeah, so, and after several visits to the ER, and he was very worried that, young men can die from high potassium. So I took a very thorough history, and I couldn't really find any cause of high potassium in his particular case. And I looked at all his labs, repeated the labs, and then I looked at his physical exam, and this is a bodybuilder. So what happens is potassium is an electrolyte that tends to stay inside the cells, and bodybuilders have a lot of muscle mass. So what he was doing, he was a very nice bodybuilder, he would pump his fist repeatedly when going to the lab to help the phlebotomist, the lab tech, draw blood and find a blood vessel for him.
Wow.
And by just doing that, he would cause his potassium shifts from inside the cell to outside the cell, which is what we were measuring in the blood. So I simply had to advise, hey, when you go there, just don't do that. Just be relaxed. Don't pump your fist. Don't contract your muscles. Eat before you go there, no need to fast. And then his potassium, it was absolutely normal. So he was taking a medication. Fortunately, he was not very adherent to taking that medication. He was keeping it. He was not taking it as prescribed, because it could have been dangerous to him if taken as prescribed, because he actually had a normal potassium level. He hasn't had high potassium in a year now. They haven't bothered me at all for it.
Wow, that's a pretty...
So he's very happy. At least this stress went away. And let me share another happy story, because that belongs to my weight loss patient group. So I have this patient who had terrible back pain, and she was scheduled for neurosurgery for her back. And she was scheduled for surgery a month ago, and she called me to tell me, hey, Dr. Mocanu, I lost so much weight. I went to see my neurosurgeon. They said that I don't need surgery anymore.
Wow.
So I was very happy. She's very happy for that.
That's amazing, and 2 success stories. And so where I know you mentioned your website before, so can you just repeat it so patients can find you? Yes,
they can look me up on my name. They can find me on the Mainline Health page, provider page, Dr. Michaela Mocanu, and they can also look for my website at www.weightkidneycare.com. I know it's kind of a long website,
but it's simple. weightkidneycare.com. Perfect. Yeah. Thanks for joining.
Thank you so much for having me here. Very nice talking to you.
Awesome. Thanks.
MedCoShare provides turnkey medical office space for health and wellness providers. Our memberships are month to month, and providers can rent one or multiple rooms based on their needs. We also have an in-house staffing and marketing team to help you grow your practice. To learn more, please visit MedCoShare.com or stop by one of our locations and get started today. If you want to hear more of these conversations as we dig deeper into the lives of our members, please follow us on Spotify, Apple Music, or wherever you get your podcast. Follow us on social media to hear more from our doctors and nurses, as well as to keep updated on all things MedCoShare. We hope you'll join us on the next one, and until then, don't forget to practice your way.